Artificial Intelligence Doctor www.abcpharma.net/English. User question. Retrieval procedure. What are the steps involved in the retrieval procedure of the Aveir VR, and what factors influence the success rate and potential complications of retrieval compared to traditional pacemaker leads? Claude AI answer. The retrieval procedure for the Aveir VR leadless pacemaker is an important aspect of its design, offering the potential for device removal or replacement when necessary. This capability is particularly significant given the long-term implications of leaving non-functional devices in the heart. Let's break down the retrieval process, factors influencing success, and comparisons with traditional pacemaker lead extraction. Steps involved in Aveir VR retrieval. 1. Pre-procedure assessment. Review patient history and indications for retrieval. Assess device position and surrounding cardiac anatomy via imaging, e.g., fluoroscopy, echocardiography. Evaluate patient's overall health and suitability for the procedure. 2. Vascular access. Typically via the femoral vein, using a large bore sheath, e.g., 1620 French. 3. Catheter navigation. Guide a specialized retrieval catheter to the right ventricle under fluoroscopic guidance. 4. Device engagement. Utilize the Aveir VR's unique docking button feature designed for retrieval. Align the retrieval catheter with the docking mechanism on the device. 5. Capture confirmation. Confirm secure engagement of the device with the retrieval tool. 6. Device detachment. Activate the release mechanism to detach the device from the endocardial tissue. This may involve a specific torquing motion or activation of a release mechanism. 7. Extraction. Carefully withdraw the device and retrieval catheter through the vascular system. 8. Post-retrieval assessment. Evaluate the extraction site for any complications, e.g., perforation, significant bleeding. Confirm complete removal of all device components. 9. New device implantation, if required. Proceed with implantation of a new leadless pacemaker or alternative device if indicated. Factors influencing success rate and complications. 1. Time since implantation. Longer implant duration may lead to more extensive tissue encapsulation, potentially complicating retrieval. 2. Device position. The location within the right ventricle can affect ease of engagement and extraction. 3. Cardiac anatomy. Individual variations in cardiac structure may impact the retrieval approach. 4. Operator experience. The skill and experience of the physician performing the procedure significantly influence outcomes. 5. Available retrieval tools. The design and effectiveness of specialized retrieval catheters and tools. 6. Patient factors. Age, comorbidities, and overall health status can affect procedural risks. 7. Reason for retrieval. Urgent extractions, e.g., due to infection, may carry higher risks. 8. Tissue response. The extent of fibrosis or endothelialization around the device. Comparison with traditional pacemaker lead extraction. Advantages of Aveir VR retrieval. 1. No long lead to extract. Eliminates risks associated with extracting long, potentially adherent leads from veins. 2. Designed for retrieval. The docking feature is specifically engineered to facilitate extraction. 3. Localized tissue interaction. Only involves the attachment point in the right ventricle, potentially reducing widespread vascular trauma. 4. Potentially lower risk of venous occlusion. Absence of leads reduces the risk of venous stenosis or occlusion. Challenges compared to traditional lead extraction. 1. Limited direct visualization. Retrieval relies heavily on fluoroscopic guidance. 2. Potential for embolization. Risk of device dislodgement and embolization during the retrieval attempt. 3. Learning curve. Requires specific skills different from traditional lead extraction techniques. 4. Large bore vascular access. Necessitates a larger vascular entry site compared to some lead extraction procedures. Potential complications. 1. Cardiac perforation. Risk of right ventricular perforation during device detachment. 2. Vascular damage. Potential injury to blood vessels during device withdrawal. 3. Embolization. Risk of device embolization if not securely captured. 4. Arrhythmias. Manipulation within the heart can trigger arrhythmias. 5. Infection. Although potentially lower risk than traditional systems, still a concern, especially in replacement procedures. 6. Incomplete retrieval. Possibility of leaving behind device fragments or components. Success rates and outcomes. Early studies and reports suggest high success rates for Aveir VR retrieval, often exceeding 90%. Complication rates appear to be low, but long-term data from large populations is still accumulating. Success rates may decrease with longer implant durations, though this effect seems less pronounced than with traditional leads. Future directions. 1. Improved retrieval tools. Development of more advanced, purpose-built retrieval systems. 2. Enhanced imaging techniques. Integration of advanced imaging modalities for better visualization during retrieval. 3. Biodegradable components. Research into partially biodegradable devices to facilitate easier long-term management. 4. Miniaturization. Further reductions in device size may simplify future retrieval procedures. While it offers several advantages over traditional lead extraction, it also presents unique challenges. The success and safety of these procedures heavily depend on proper technique, appropriate patient selection, and the use of specialized tools.